So it's a hospital where more than 50% of the folks speak Spanish. So we're tackling that barrier of like having to design, a translator component to this, having to do it in a place that is a hospital that's resident run, having to do it in a place where the resources might not be as much. And a lot more collaboration is needed because right now we have it in different hospitals that are academic centers and a little more resource rich. So what does it look like when we're making sure all the communities get access to this new thing that seems to be helping patients with their anxiety of diagnosis, helping patients have higher health literacy about their diagnosis, deal with the uncertainty of diagnosis?
Welcome to the People of Pathology podcast. I'm Dennis Strink. On this podcast, we explore pathology, laboratory medicine, and forensic science. What would it look like if pathology became a direct tool for empowering patients? In today's episode, I talk with Dr. Kene Ojukwu, a pathologist who's working to do just that. Dr. Ojukwu shares how she blends her background in pathology, public policy, and education to make pathology more inclusive, accessible, and visible. And we'll see how this makes pathology a bridge between complex medical information and the people it affects most. All right, let's get into it with Dr. Kene Ojukwu. So how did you discover pathology? And then tell me, how did you know that this was the right field for you?
That's a long story, but just to give you the shortened version, I discovered pathology as I was leaving surgery as a specialty. So I knew I came into medicine because I loved anatomy. Mm-hmm. And I was trying to figure out, after realizing that I did not necessarily want to do surgery anymore, what the next step was going to be. So my goal was to become an anatomy professor. So in seeking that route, I remembered a mentor I had who actually ran the anatomy program at my medical school. And I was like, wait, what is she again? And I was like, oh, she's a pathologist. And that began my investigation into what that was, and that unfolded. And ironically, when I came into med school, I said I wanted to be a coroner or a surgeon. And, coroner is not as sexy sometimes as surgeon. So I ended up funneling towards surgery. And it was I just felt like it was full circle, like realizing that. And so I did a 6-week type experience in pathology. And I just was like, whoa, this is it. Like, this is where I can thrive. And I really enjoyed it. And from then on, I think it's probably the second best decision I ever made. First best one was with getting married to my husband.
Okay, I like it. But you said you did a 6-week rotation. Did you know right away, this is perfect, this is what I want to do?
No, the first day we grossed like 13 placentas.
Oh.
And if there was one specialty that was rough for me in medical school, it was OB-GYN.
Okay.
So I was like, this is a sign. What am I doing? Why? So at first I remember calling my sister just so upset. And she's like, okay, relax. And she just talked me through it.
Okay.
And after that, the next day, it was just a mix of specimen. So I had a good time. Okay. And I learned, and my mind went all over the place in a way that I enjoy. So it worked out. Yeah.
Oh, see, I don't know if I told you, I'm a PA, and placentas are my favorite specimen to gross. So that hurts a little bit.
I'm sorry. Placentas every time. I know they could be a 5-minute gross, but they just get on my nerves. That umbilical roll, or that calcified lesion you're trying to get on the parenchyma just won't work with you. Yeah.
Okay. All right.
But yeah.
A couple other things I want to talk about as far as educationally. You have a master's in public health, but you've also got a master's in public policy, which this seems kind of unique. What inspired you to pursue that degree as well?
So I started off med school in the Prime program, and I was the inaugural class at UCLA, Prime Leadership.
Can you explain what that is? I haven't heard of that one before.
Sure. So all the UCs in California are associated with a program that's used hopefully to enrich a community and enrich a skill, because the goal is to put out doctors who are community oriented. Okay. So we were trained with leadership skills with this intention of making sure they give us physician like leadership skills to go in the community and build something beyond the medicine. So and the program's still going. I think they're probably on their like 14th class by now. So, but we came in with the intent that we were going to get a master's. So I knew I wanted a master's, and I initially had been thinking about business, but then just in different conversations, I realized how important policy is, specifically like in medicine, and then specifically in how we're educating our trainees.
Okay.
Because curriculum is policy in a way, and that what you set up at the beginning of the year is what the students get to experience. So I just felt like there were so many components. Nonprofit policy was kind of what I focused on in education policy. And I just felt like that could make a difference if I knew my way around policies, because that guides where money goes, that guides where knowledge goes, that guides where power goes, that guides how decisions are made. And it could better a community if you know your way around policies.
Okay, that makes sense. That I can see how that would be useful in medicine. How do you feel it intersects with your work in pathology?
I think it's actually heavily influenced. So I proceeded to actually do the National Clinician Scholars Fellowship at UCLA, which is a multidisciplinary program that focuses on bringing research, community, and policy together. So I got to interact with people like CMOs in hospitals who are making decisions about how budgets are being done, interact with people who are guiding some of the NIH policies. And I think all these things affect us as pathologists. There's some reimbursements for some of the work we're doing, whether technical or professional. So one of my manuscripts that I wrote is along the lines of the idea of melanoma outcomes for patients and essentially like IHCs being used, and keeping in mind the policies for how IHCs are being reimbursed. So it's this idea of exploring like even how we're getting paid, and how that's influencing patient care, and are those two meeting where they need to meet to improve patient care.
Okay, I see. So it seems like that would be very useful then.
Yeah.
Okay. Interesting. All right. And the next thing I wanted to ask you about is you did a project it's called Knowledge is Power, Community-Centered Pathology. Can you tell me about this project? Like what inspired the project, and then what has been the kind of the community response to it so far?
Sure. So that name was coined with the idea that we just felt like as pathologists, we can bring knowledge to community.
Okay.
And this was also during the era where I think pathologists were really trying to be more visible, right? I was in residency at the time, and at that time I had just learned of Dr. Joseph. And because I was exploring this idea of what would it look like if patients saw their own slides. And I stumbled upon her like first publication on patients looking at their own slides and how it helped. Yeah. So I was in a county facility where resources were not as present. So we thought about what does it look like if we took microscopes to a health fair. So what we ended up doing is bringing pathology booths to health fairs. And having patients look at, we focused on initially on colorectal cancer. So had them look at a normal biopsy, a tubular adenoma, a TA, and then a cancer. And just, we had endoscopy pictures that correlated with each of the slides, and had that conversation about what is the actual workflow when you go for your colonoscopy, and what is it that we're looking for to diagnose, whether it's just a TA that they got out, so that's great. They caught the precancer versus the actual cancer. And it was received very well. People felt like they learned and they enjoyed the conversation. So the next one we did was a back to school fair. So we did this for kids. We brought the microscopes out again, the 3 microscopes, but we focused on just organs and them looking at organs under the microscope. And the idea of this was exposure of STEM to youth. So it was brain, it was kidney, it was skin. And then we had them do a matching game of like recognition of what you saw under the slide and then outside the microscope. So it was this way of having them engage in it. And then also, which organ would you have a rash? Which organ would be affected if you had diarrhea? So those type of games in our little stations, and they enjoyed themselves. They asked questions about pathologists, and we did pre and post for these. And then we also did the colorectal cancer again when I moved to my new institution. And this was not county academic, but it was received with warmth, and people, there was a family I talked with that were just really grateful. They had a family member that had died of colorectal cancer, and they just said that this is needed. Like, this type of education is needed and wanted. So that was very encouraging. So we're looking for opportunities to continue to bring pathology in a community-centered way. What was cool was with the colorectal cancer, they had an inflatable colon. So that was the GI team. So they could walk through the colon, look at the cancers like grossly. They'd come and look at it under the microscope. So it just really worked well together.
Yeah, I can see how making that connection would be really powerful. And then the other part of going and educating kids about this, now you're exposing a whole generation of, future pathologists, future clinical laboratory scientists, future PAs even. That's brilliant.
Yeah. And when we do these projects, we do invite our PAs to come and join if they're available, because I do think it's so important that there's so many components to hospital care. And oftentimes, you hear about doctors and nurses, but there's just so much you can do in the realm of science. And the more exposure the kids get, the more they know it's possible.
Yeah. That's great. That's great. Those are wonderful initiatives. I thank you for telling me about those.
Yeah, of course.
Those are great. There's another one I want to talk about. You're involved with efforts to increase health literacy through dermatopathology education.
Yes.
All right. So tell me about this. How do you approach explaining? Because again, I'm a PA, and some of the derm stuff is pretty difficult to understand.
Yeah.
How do you approach explaining that to patients?
Yeah. So this is in process. I think I mentioned Dr. Joseph, who has definitely inspired me a lot. So I am now getting the opportunity to develop and implement a pathology clinic where patients can look at their slides. So we're starting off in a dermatology clinic. We're collaborating with dermatologists and working to design this derm path clinic for patients with specific types of skin cancer and to have them look at their slides. There's a lot of literature on patients looking at their dermatology reports and not understanding it. And like a number of patients will look at something that's supposed to be benign and be super anxious and super worried about it, which indicates some level of not understanding. So when we figure with our dermatology colleagues, they have a sense of what we do as pathologists because they're trained in PathA a bit. So so we're exploring some of that and working with residents to actually, dermatology residents, to start to introduce residents of other specialties to this idea that pathologists can work with patients to learn a little bit more about their diagnosis. The goal is to make sure a patient knows what their diagnosis is and understands it. That's it. With the pathology clinic. If a patient can look and say, and tell their family member, hey, they told me I have basal cell carcinoma. They told me it's a carcinoma, which is a cancer. They said it's not a cancer with bad prognosis, but it's still a cancer. And I saw the ugly cells under the slide, and I saw the normal of what it's supposed to look like. Mine, they cut it all out, and I saw the whole circle of it, or it's touching the one edge and the other edge is still in me, and they have to go back and cut out more. So kind of giving them language that goes with looking at it under the slide. And the other component is we're working with the derm clinic within the safety net hospital. So it's a hospital where more than 50% of the folks speak Spanish. So we're tackling that barrier of like having to design, a translator component to this, having to do it in a place that is a hospital that's resident run, having to do it in a place where the resources might not be as much. And a lot more collaboration is needed because right now we have it in different hospitals that are academic centers and a little more resource rich. So what does it look like when we're making sure all the communities get access? to this new thing that seems to be helping patients with their anxiety of diagnosis, helping patients have higher health literacy about their diagnosis, deal with the uncertainty of diagnosis. So I think it's just a modification of the pathology clinic, which Dr. Joseph and other pathologists are doing in different places like Duke, Boston, Michigan. Yeah.
Yeah, I'm going to have Joseph on the podcast in a couple of months. So we'll talk more about that. One thing though, I've talked about this with other people previously on the podcast, specifically Dr. Jason Wasserman. You might have heard of him, my pathology report. He was talking about translating pathology language into a way that patients can understand. It seems like that might be difficult sometimes, especially again with dermatopathology diagnoses.
Yeah. He does an excellent job on his website, the resources we're using.
Yeah.
And I know he has some element of even being able to integrate that into some EMR. I know folks associated with him have spoken about that.
Yeah.
So we're using that as a resource for the patients as well. But you're right. I mean, I'm exploring a project with a colleague around that language. Like there are a lot of pitfalls when you're translating derm language in English, not to even mention another language.
Oh, I didn't even think of that.
Yeah.
Wow.
So I think it's not a straight translation when we're talking about like sunburn, or some of that.
Right.
So it's something that I'm keeping in mind. Communication and diagnosis is where my research work is going. And it will involve everything like visual communication, like we do with our microscopes, all the way to like using AI standardized patients to train the group that is working with patients to communicate diagnosis.
Interesting. Yeah, I was going to ask you about like some challenges in these sort of bringing pathology to be more patient facing. And I think we just talked about language barrier for one, and then just translating the pathology jargon, I guess, into a more, I guess, maybe simpler language or easier to understand language. Are there other challenges? Things like, I don't know, funding or something like that?
Money's always a problem. But I do think like we're in an era where people are looking for innovation, where people are looking for new ways to do things. And especially things like ChatGPT or AI coming out there, and VR being more used in medical education. I think there are all these opportunities that we have to explore. So my focus is innovation in medical education, and my goal is to explore all of these and not just explore them at my level, like to have the medical school trainees explore them. The people who are undergrads who are going to become PAs and other part of the laboratory workforce, like they should think about how we can use these things to enhance what we offer to patients. Even like, for instance, one of the projects I'm doing with a wonderful undergrad and a wonderful medical student, we're looking at semantics in language around cancer. I'm working with Semantics for Cancer lab at UCLA that composes of linguists and surgeons.
Okay.
And we're looking at the words of cancer, tumor, neoplasm, and how we use them and how that translates to patients. But we're looking at how the undergrads look at these words. Like they're pre-med, they're not trained yet. And it's been shown in literature that empathy declines as you move through your training. You get and it makes sense. You're more numb to things, right? Because you're seeing it more often.
Okay.
And we think that language becomes more sophisticated and more technical. And we forget how to speak layman's terms. So we're looking at different levels like pre-med, like STEM students, then we'll look at medical students, then we'll look at residents and faculty to see where they fall. And we ask a variety of questions just to look at language in discussion of diagnosis. Okay. So that's what, so I feel like in targeting this from different angles, whether it's AI or semantics and cancer and linguistics, there's funding in all these places.
Yeah.
And these are all things that people are looking to explore. So I think we're just being creative, making, and our creativity lends to people wanting to explore it and offering funding to do further.
Mm-hmm. so many things you're saying I've never thought of before. So this is very interesting. This is the People of Pathology podcast with our guest, Dr. Kene Ojukwu. We'll be right back. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to PathA, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing to writing a standout personal statement to prepping for interviews, this course was made to help you feel informed, confident, and ready. Visit www.thepathtopatha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. LabVine is an interactive online learning platform where laboratory professionals learn, develop, and discover by sharing knowledge and building on each other's experience. The platform provides global access to internationally accredited laboratory-specific courses and other resources developed by lab specialists, like us, for the laboratory industry. LabVine is free to sign up, and you can use the link in the show notes to get started. Now for the rest of my conversation with Dr. Kene Ojukwu on the People of Pathology podcast. Can you tell me about your work with a UCLA National Clinician Scholars Program? You're focusing on creating inclusive curricula. What does inclusive pathology education look like to you? And what impact do you hope it will have on the future for healthcare professionals?
Sure. So the National Clinician Scholars Program, previously known as the Robert Wood Johnson Fellowship, I think there's 6 sites in the country. UCLA is one of them. And we're a group of multidisciplinary, so all specialties of medicine, as well as PhD trained nurses. And we're there to explore concepts that are affecting different communities. For me, so everybody usually comes in with like a platform of some sort. Medical education has always been top of my list.
Okay.
And I've always felt like everybody learns differently. You know, some of the most basic things are you an audio learner, a visual learner, a kinesthetic learner.
Yeah.
And even something like that, thinking about how somebody learns before you teach, that is inclusive, period. Right? So what does it look like when we're inclusive to communities in terms of their learning about medical education? As I've mentioned, like some of my projects are this community-centered pathologist component. So what does it look like when we actually take slides out to health fairs? Some people are more technical than others. So some patient community members are going to get it. But maybe other community members need something different, whether it's an interpreter, right? Okay. Or maybe they have less than 5th grade education and they need things explained in a more simpler version. So you have to make sure you bring somebody who can do that type of teaching. So I think it's about thinking about the different components of whatever curriculum in the project that you're putting out there. And for me, all my projects are really about teaching. So to do that, I think you have to think about how people learn the concept that you're teaching. And so inclusive means keeping in mind all those perspectives and all the different stages that you're trying to hit.
So how do you figure out how people learn? Is it just trial and error? Like you go there and you try some things, and if it doesn't work, you try something else. You know what I'm trying to say?
I do. I think that's part of research. We're actually collecting data on certain things.
Okay.
So let's see. For instance, I mentioned the survey that we're dispersing to undergrads.
Yeah.
To learn a little bit more about, so there are like multiple parts to the survey where we're collecting information on their stance on language, the English language. Then we learn a little bit about their anxiety when they're in clinical spaces. And then we learn a little bit about how they feel if they were given diagnoses, right? And then we ask them what, about tumor, about masses, about neoplasm, which one means cancer. So this is at the undergrad stage. So their technical training is less compared to somebody who's a resident. But our goal is to be able to ask these questions at different levels and then be able to sort out like where, because there's a unintended curriculum that's happening, right? So what does it look like if we actually paid attention and intentionally made sure folks learned how to communicate these things? because we're learning how to communicate it to our colleagues, but we're not learning how to communicate it to patients.
Okay, yeah.
It's kind of inferred. You pick it up as you go. But what does it look like if we're more intentional about it and figuring out the pitfalls of it? So to do that, you have to take into account all the different perspectives and then design something that is a little bit more about individualized learning. A person can self-assess and feel like, ooh, I have a gap here. Let me do better here. So in the end, I think it's about empowering people to self-assess to figure out their gaps. That's actually what I think the key thing is. But for people to self-assess, they have to want to. They have to have time to. They have to think it's important to. So it's generating a different sense, a different approach. And it's not just like, okay, here's a checklist, get it all done. Okay, I'm done. I'm the most efficient medical person. How does this affect care? How do I teach somebody so they know it affects care? It's not just about getting it done.
Do you have an example of where you've used this method and it's worked and you saw that it was working either with the resident or in talking to patients and you were like, yes, this is working? Because that's got to feel good when you finally make that connection and somebody understands.
So I think, honestly, we spoke a little bit about the lab space that I'm creating for innovative medical education. And I work with folks who are medical students or undergrads. And essentially the criteria is that you're interested in doing a community-centered project of some sort.
Okay.
That's my main criteria. And the idea is that they come as an individual. And I ask them, what is it you want to learn about research? Some of them are IRB. They want to learn how to do that. Some of them want to learn how to write papers or put out papers or do abstracts or do posters. But we start to design what it is that they feel their gaps are. And then I tell them what I think their gaps are. Then we have other mentors that they have that tells them what they think their gaps are. And then we find a way to collate it. Okay. So it's this way where they're designing their own curriculum so that they can become better for themselves based on who they want to be, as opposed to who the system wants you to be. That's honestly my goal. Because I think if we create doctors who keep in mind why they came into doctorship in the first place, that could be powerful.
I can see, especially in pathology, because we're usually, I guess, at least a little bit removed from patients, although that's starting to change, especially with your work. But you're helping the residents to understand human impact of pathology, right? Is that what we're talking about?
Yeah. Helping them remember that they're human and they're impacting humans.
Yes, which is important. And sometimes I think we might forget that.
We do. And I mean, you kind of have to, because you need to be right when you make those diagnoses.
Yeah.
You need to be robot level right. You're not always. So there's some studies that go with well-being, of being wrong, which is our complication in pathology. And how are people dealing with that? And what are we doing to make sure folks are learning in a non-toxic way how to deal with being human as a physician?
Okay.
Yeah. So I think part of it is knowing what your weaknesses are, knowing how you learn best, knowing how to have a conversation with another clinician if you made a mistake. And I'm sure, as a PA, everybody's made a mistake. I'm sure you've made a mistake and you've had to be like, hey, I made that, take accountability for this, but also knowing what impact is that going to have to the patient care that you're contributing to.
Right.
And then caring about it. These are how we make the system better. It's with that type of intention. And that's something really hard to teach, I think.
Okay. Yeah, I can see that.
Yeah.
But makes sense.
Yeah. So I think it boils down to priorities. If it's your priority to step into the space, be your most authentic self and do your best work and communicate your best, that's what we can ask for. But I'm diving into philosophies now.
That's okay. No, that's all right. I like talking about that stuff. Interesting. Okay. All right. So then kind of tying back to what we were talking about towards the beginning, your work in your master's in public policy. And as you've been telling me all of these things, I'm trying to connect how that education might influence all of this work that you're doing.
So with that, I'm part of the patient champions group. So I work in committees, and oftentimes committees put out policies. So I think my perspective lends to some of those policies, my work in county systems and low resource systems. I'm a big advocate for medical trainees. I don't think we have to suffer to learn. I think it could be challenging, but you don't have to suffer. So I'm always an advocate for policies that lends to enhancing the space that the trainee has to study, like a space that allows for learning and good learning. Yeah. Like making sure that the pressure that they get is good pressure that makes them better. So that's where some of my policy, like active policy stuff comes in.
Okay.
Otherwise, I'm involved in international pathology, currently working on a study where we're counting a number of pathologists on the continent of Africa. It was done in 2015 by Dr. N. Nelson and Dr. Dan Milner.
Okay.
So we're trying to work on that to update that information and just look at resources, how resources are allocated. And I think policy will come into play there again. Yeah, so I do work with a surgical resident, actually, who her work is specifically within Mozambique, where she's looking at pediatric surgery and looking at how all the teams, like anesthesia, radiology, come together to give good patient care. So that's all policy, how all that's set up, how those systems are set up.
Okay.
The rules that dictate that is policy, but now using data you collect to try to enhance that interaction, that's being able to influence policy. So recognize where the policy is, kind of advocate for the change that you think will make it better. So that's where some of my policy training comes into play, because then we have to look at like economic pros and cons, and then health outcomes, pros and cons, things like that.
Okay, that makes sense. The last thing I wanted to ask you, with all the things we've talked about and all the work that you're doing in a lot of different areas, we're looking ahead to future of pathology. And what do you hope that future is going to look like? Not only as a medical specialty, but as a tool for health equity and community empowerment.
Patients have different struggles with diagnoses, right?
Okay.
Sometimes it's the fact that you've gotten a terminal diagnosis and you're going to die. That's one like emotional struggle. But I think if we can minimize the struggles they have with our medical system as they're dealing with hard diagnoses, then that would be so cool. I think diagnosis is our world as pathologists. Well, I'm a surgical pathologist, so I'm really like biased. But like, I feel
I'm with you on that one.
We say, oh, the patient has this, the cancer has gone to this organ, and this is what the patient-facing clinicians are riding off of as they move forward in oncology and all that. So I feel like if we can help the patient navigate whatever confusion is in that workflow, and we don't have to physically help them navigate, just make it clearer with our reports or offer touch points where they can come and ask questions about their specimen, even create a VR tool in which they can actually see the organ and see like where these cells are so that they can understand it and share with their family. Then we're minimizing the stress they have with the system. And they can now just focus on their life, their family, and the many other problems that happen outside of medicine. I mean, that's my bigger picture. With pathology, I just think there are all these cool things that are being developed, everything from IHCs to molecular to just some super cool like AI stuff.
Oh, yeah.
But a lot of that is not touching most people. A lot of that is touching like our higher tier spaces.
Yeah.
What about folks who have lower economic status? Like, how do we make sure that folks with less still get to benefit from all these technologies? So I don't know if I'm as much about like building new stuff in that space. It's more about the stuff that already exists. The programming that exists is so cool. How do we take it to these other spaces that people are not paying attention to? we can make sure other people are benefiting from this really cool thing. And it could be as simple as PRAME IHC, like an IHC that I encountered for the first time when I left my county program because we didn't have it in county.
Oh, okay.
So it doesn't have to be abroad. Like there's spaces in the US that are diagnostic deserts. Like, are we bringing stuff to them that they need in a way that's effective, in a way that's system oriented? So that's some of where my policy stuff comes in as well.
You're talking about, again, about inclusivity and I guess accessibility.
Yeah.
Yeah.
That's a great way to put it. Like, I attended an excellent talk by Dr. Omid Garner at UCLA. And he talked about this idea of a study he did on, he's a clinical pathologist, but it's this idea of if you need a blood work right now, how long does it take you to get it? Like, I'm in a hospital. I probably could, have an appointment in 5 minutes.
Yeah, there's a
if I really
right
needed
down the
it.
street from me.
Yeah.
Yeah.
For some people, it would take 2 hours. For some people, it would take 2 days, a week. Like, what does that look like? Even though the technology exists, what does it look like not to have access?
Okay.
Right? That's a different barrier. That are we trying to solve the access problem? And we are. Some people are doing a lot of work to solve that. I think I'm probably thinking about it from access to education component. That's the work I do. But it's just access to diagnoses that are accurate, that are timely, that can make a difference in your care.
Okay.
That's important too. And it would be nice to see a future in pathology where we make progress in that.
Yeah. This has been a fascinating conversation. I certainly have a lot to think about after talking with you. Just my brain is exploding with ideas. Hopefully that's for all the listeners as well. Thank you so much for sharing your thoughts on these things. And it's been wonderful to get to know you a little better and to learn about the work that you're doing, which is amazing. Dr. Kene Ojukwu, thank you so much.
Thank you. I appreciate your time. It's been a pleasure.
Yeah. If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Dr. Jason Wasserman as we talk about the origin of the website mypathologyreport.ca.
We are not the one making the reports available. What we're saying is the reports are available. The patient's already, what do we do now? What do we as a profession do to help our patients understand what we're trying to say in very complicated language, right? We don't speak in simple language of pathology. What do we do to help our patients? What do we do to help our clinical colleagues so that they can explain the report to patients? But also, what are we doing to advance our profession, to show that this is what we do and it's important, the work that we're doing, and explain from our perspective what it is that we are contributing to medical care. So for all those reasons, I thought it was important to push on with this. And there are still detractors, and I respect that. But there's a lot of people who are also very supportive because they realize that the patients are reading their reports now. So we might as well do something.
You can hear more from Dr. Jason Wasserman in episode 172. All right, big thanks to Dr. Kene Ojukwu. I hope you found this conversation as inspiring and thought-provoking as I did. An interesting part of Dr. Ojukwu's story is how her love for anatomy first pointed her towards surgery, but ultimately helped her discover pathology. It wasn't a straightforward path, which of course is a common theme among many of the guests on this podcast. Dr. Ojukwu's work reminds us that pathology isn't just about identifying disease. It's also about communication. Her Knowledge is Power project is a perfect example. By allowing patients to actually see and understand their pathology slides, she's not only demystifying diagnosis, she's helping people reclaim a sense of agency during some of the most vulnerable moments of their lives. She's also redefining what medical education can look like. Through the UCLA National Clinician Scholars Program, Dr. Ojukwu is building inclusive curricula that take into account the diverse backgrounds and learning styles of medical trainees. She views curriculum as a form of policy, one that can either uphold or dismantle systemic inequities in healthcare. By prioritizing human-centered learning and community-rooted experiences, she's helping shape a new generation of doctors who understand their impact beyond the hospital. In her dermatopathology work, Dr. Ojukwu is using visual learning and direct patient education to tackle something that we don't talk about enough: health literacy. She shows us that when patients better understand their diagnosis, they experience less fear, make more informed decisions, and feel more supported on their health journeys. As a result of these projects, pathologists can play a critical role in translating complex medical information into understandable language for patients. Dr. Ojukwu's efforts also include educating children on pathology to inspire future generations of laboratory professionals. Pathology then becomes more than a medical specialty. It becomes a vehicle for equity, for empowerment, and for reimagining the relationship between medicine and society. As we discussed, all of this relates to the integration of public health, public policy, and pathology. This creates a single, unified mission to make healthcare more accessible and more human. As always, I'll have links in the show notes to everything that we talked about today. Don't forget you can follow the show at People of Path on both Instagram and Twitter, or just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.